Welcome to our YouTube channel, where we dive into important topics related to women's health. Today, we'll be discussing vaginal discharges, their virus types, how they appear, when is the discharge normal, and when is it essential to reach out for medical treatment. Let's explore the most common types of vaginal discharges and what they might indicate. The first type of discharge we are going to look at is a clear, watery discharge. This is a thin, transparent discharge resembling water. The discharge is usually minimal and is non offensive. This discharge can come during a normal menstrual cycle, during ovulation when the egg is released in preparation for pregnancy. It can be the result of a normal, mild hormonal changes in the body. This is a similar discharge that appears during sexual arousal. The discharge is normal if there is no offensive smell. When you find that the discharge is offensive and watery, it could be a sign of infection. Serious illnesses such as cancer can present with watery, foul, smelly discharge. It is important to seek medical help from a professional who will examine and conduct the relevant medical tests according to your condition. The second type of discharge is the white, thick, cottage cheese like discharge. The women describe the discharge as a thick, lumpy discharge resembling cottage cheese. This condition is called candida or thrush, which is caused by an overgrowth of yeast in the vagina. The discharge mostly presents with an itchy vagina and itchiness on the outside of the vagina. This type of discharge is common in women of all ages. This type of discharge can be caused by a normal hormonal change in the woman's body. It can be caused by contraceptives that we take to prevent pregnancy. It can also be caused by the use of certain antibiotics, just to mention a few causes. It is reported that every female will have at least one episode of thrush or candida in their lifetime. The third type of discharge is a gray or grayish white discharge. The grayish discharge presents with an offensive smell. Women describe this smell to be similar to a fish smell. This type of discharge is caused by a bacteria called bacterial vaginosis, or BV in short. It is a common vaginal infection caused by an imbalance of pH and bacteria in the vagina. This can be caused by hormonal changes, contraceptives, and even the presence of sperm in the vagina. The fourth type of discharge is a yellow or greenish discharge. A yellow or greenish discharge is often accompanied by an offensive smell. This type of discharge is indicative of infection such as Trichomonas vaginalis or sexually transmitted diseases. It is important to consult a health professional provider for an accurate diagnosis in order to get treatment as early as possible. It is crucial to seek medical help if you experience any of the following. Number one, persistent or worsening symptoms, which could be the discharge, a smell, pain, or itch. Number two, if you experience pain or discomfort during urination or sexual intercourse. Number three, if you experience vaginal bleeding or spotting outside of your regular menstrual period. Number four, if there's signs of sexually transmitted infections, such as genital sores, itching, or burning. A doctor or a primary care provider will perform a thorough examination, including collecting a sample of the discharge for laboratory testing if necessary. Based on the diagnosis, appropriate treatment options will be recommended. which may include some antifungal medication for the yeast infection or some antibiotics. Here are some self care tips to maintain good hygiene and prevent discharges. Wash daily with mild, unscented soap and water, as scented soap may cause irritation of the vagina and the genital area. Wear breathable cotton underwear to promote air circulation and minimize sweating and moisture. Avoid dodging or using scented products, as they can disrupt the pH of the vagina. Practice safe sex and use condoms always to prevent STIs. That's all we have for you today. Thank you for watching.